If you follow plastic surgery trends online, then you probably have heard the excitement over the deep plane facelift. You might think this is a breakthrough of some type, but in reality it's been around for decades. I started doing the composite version of the deep plane facelift about 40 years ago. In my opinion, the composite variation of the deep plane facelift is by far and away the best. I moved to the composite facelift and away from more conventional facelifts primarily for one reason, and that was the provision of blood supply to the skin. I'll explain more about that in a minute. Along the way, I discovered other advantages, and I have made adjustments in technique to improve the results. The composite facelift also changes volume distribution to the face by restoring fat complexes to a more youthful position. Finally, about 10 years ago, I added sequential tension suturing to allow for tension-free closure of the skin. This results in better scars, no distortion of facial anatomy, and better blood supply to the skin. In this diagrammatic, the skin, which is colored blue, sits atop the fibrofatty layer called the SMAS. That's an acronym for superficial musculoaponeurotic system. The skin is elastic, whereas the SMAS is relatively inelastic. A plethoric blood supply is provided to the SMAS by branches of the facial artery, and you see that diagrammatically represented here. The composite facelift elevates the tissue of the face deep to the SMAS, leaving the skin attached, thus the term composite. Other deep plane facelifts separate the skin from the SMAS, which I don't think makes a lot of sense because of the compromise of blood supply to the skin. Facial artery gives rise to the angular artery, which in turn arborizes into the SMAS. After this, as an irrigation system went to grass, it uniformly distributes blood supply to the entire face. By peeling the skin off, then that irrigation system is disrupted. So that's the reason that we like to use the composite and maintain good blood supply to the skin. This is a patient with somewhat of a gruesome picture, but it demonstrates that she had a composite facelift and at the same time had a full face CO2 laser. The reason we can do this is because the good blood supply allows us to heal without any difficulty. If the skin had been separated from the SMAS, that blood supply would be compromised, and there would be a good chance that the skin would not survive this sort of laser assault. And you can see here that the patient did quite well. We did the facelift, and you see how much better the skin looks in the wake of the resurfacing with the CO2 laser. The second major advantage of the composite facelift is repositioning of the mid-face fat that you see here in the malar fat pad to a more youthful position. The change in the volume distribution of the face can be dramatic. If you look at this patient, notice the rectangular shape to the face, and by repositioning the mid-face and the malar fat pads, it becomes more heart-shaped, which is what we're after. And here you can see that the mid-face fat has descended to the point where it breaks up the line of the jaw. This is then repositioned. It's not removed, it's repositioned, and that reestablishes the line of the jaw as well as adding volume to the upper part of the face, which is what we're after aesthetically.